Right, we often think of loneliness as something that may come with old age, but a new study finds an unexpected group feeling it most. Researchers just found that although loneliness generally increases with age, younger adults in the US and in the Netherlands are experiencing higher levels of loneliness. For more on this, I'm joined by Dr. Sue Varma. She's a psychiatrist, and she's also the author of Practical Optimism, the art, science and practice of exceptional well-being. Great to have you with us on this topic. So help us understand, why are younger adults in the US and the Netherlands experiencing more loneliness? What age range are we talking about here?
Yes, we're talking about middle-aged adults, so 40s and 50s, and there are a variety of reasons. The easiest one that comes to mind is the sandwich generation. This is a group of people who are involved in caretaking for both aging and sick parents and also young children at home. But we also know that if you are working remotely, you're more at risk for loneliness, or if you've lost your job, you're more at risk. Not to mention the fact that there's so much emphasis on individualism that we have to have it all figured out by ourselves, that asking for help or leaning on other people is somehow a sign of weakness or vulnerability. Then we also know that being unmarried is a big one, and not to mention the fact that people really aren't as involved and engaged in social and civic and religious institutions as they once were.
And this might be surprising when you consider we've got increasing populations everywhere. We've got smartphones that keep us connected to social media. So why, if we're more technologically connected, do we feel more isolated?
So I think of social media in a way as, like a snack or fast food, in that it gives you the impression that you are ingesting something. But the problem is, what is the nutritional content of it, and how likely is it to keep you satiated and full on a deeper level? So I think it creates this illusion that we're very connected, right? Like, I even find myself when I'm on social media writing or reading people's comments and thinking like, oh, I'm a part of something. And then I'm like, wait a minute, a whole day has gone by. Have I seen anyone else outside of my household in person? And so you feel like you're part of something. And look, I have to say that social media is excellent in connecting us to other people if we want to take it offline. So I have met so many other author friends, mom friends, colleagues I have met, and the key is that we need to then meet in person. And I think one thing that I'm seeing a lot, I see this in my patients, is number one, are people even aware that they're lonely? Because they don't. And it may present as depression. And really, when you look at it, you go deeper and, you ask the person, tell me a little bit about your social connections. And then you hear that there's a real paucity of them. And then you ask them, what are your attitudes towards developing new friendships? And they're like, oh, that's just so weird. I'm not a stalker. I'm not going to go up to some random person. And then especially from younger college students, I hear everyone has their headphones on, and I couldn't just go up to someone and try to bother them. It clearly says do not disturb. Why else would they have their headphones on? So do you present yourself as being approachable and interested and willing? And there's so many opportunities, what I call micro connections, where you're at the elevator, the water cooler, you're at the bus stop, you're at the grocery store line. If you just take your headphones off, if you smile, if you seem somewhat interested and you're looking around, make eye contact with the person, assuming you want to. A lot of people are afraid, of their safety and all sorts of things. So I get it, but you have to be very intentional and deliberate and put yourself into what we call third spaces, these bookstores, these cafes, pickleball, cycling clubs, really make yourself available to social interaction.
Yeah, we know third spaces in communities across the country are shrinking, they're evaporating, but the advice you give is really useful. I used to hate small chit chat with strangers, but now I think that's actually social glue that helps us be able to relate to one another. Dr. Sue Varma, great to have you on this topic. Folks should read your book. Really enjoy chatting with you today.
Thank you so much.